Hello, so I have your lab requisition here. Could you please spell your first and last name and tell me your date of birth, please?
Tylannorth, January 6, 2005.
All right, perfect. So my name is Parker. I'm going to be your medical assistant today. And so today we're going to be drawing some blood. Some of the possible risks are hematoma, bruising, bleeding, pain. Do you acknowledge those risks?
Yes, I do.
Okay, perfect. And so do you have a latex allergy?
No, I do not.
All right, perfect. And so I just have a couple other questions for you. We're taking any medications currently?
No.
Okay, and do you have a history of fainting?
No, I do not.
Okay, perfect. And have you been fasting?
Yes, I have.
Okay, and how long have you been fasting for?
Since last night.
Okay, perfect. And do you have an arm preference?
I'd like to do my right arm.
Right arm, okay. And do you have any other questions for me?
Nope.
Okay, and do I have your consent to continue?
Yes.
All right, perfect. So I'll now be assembling the needle with the tube holder. Taking out this back cap, screwing this in. And I've gathered my test tubes, my red tube and my light blue tube. Now I'll be washing my hands and donning gloves. Using I have some hand sanitizer here. Making sure to rub until it is completely dry. Now don gloves. Alright, so can you place your arm up on the table for me, please? Alright, so I'm tying a tourniquet 3 to 4 inches above so that I can palpate the vein. Alright, can you squeeze your fist 3 times and hold it for me, please? Alright, perfect. Now I've established the site. Using an alcohol swab. I'm going to wipe the site in circular motions from the inside out. Alright, now I'm letting that air dry. Now I'm going to tie a tourniquet again 3 to 4 inches above the site. Using the slip knot. Alrighty, now I would take this cap off, uncut the needle, inspect the needle for defects, for safety reasons. I'm going to leave it on. Alrighty, then now I have his arm positioned. I'm going to anchor the vein with my left hand, with my right hand, with my thumb on top, the cap, index finger on bottom, 3 fingers below. Anchor the vein, I'm going to go bevel up about 15 to 30 degrees. Alright, now it's in. Use my red tube first. Insert the tube. Alright, red tube is filled up. Light blue tube is on. Releasing the tourniquet. Waiting for light blue tube. Alrighty, now I'm ready. I'm gonna add gauze. Alright, can you hold that for me, please? Alrighty, patient's now holding the gauze. Needle would be recapped and disposed in the sharps container. Now, 2 tubes. I'm going to invert them. Alright, now I would put the patient's name, date of birth, the date, time, and my initials on both tubes. Again, patient name, date of birth, time, date, initials, both tubes, and then I put them in the transport bag. All right, can you keep holding that for 1 more minute, please? All right, perfect. Patient's holding that for 1 more minute. All right, 1 minute has passed. All right, so see that right there, I'm inspecting. All right, bleeding has stopped. Last patient, would you like me to apply a Band-Aid?
Yes, please.
All right, perfect. Apply Band-Aid. Band-Aid is applied. I'm now going to clean up my space, removing any trash and waste. All right, now I'm sure the patient can stand up and walk. All right, you can stand up for me. All right, all good. No lightheadedness, no fainting.
No.
I'm feeling dizzy. All right,
Good.
perfect. All right, thank you. You're all good. And then now I will doff my gloves. And wash my hands.